Hello everyone, I am Monica de Guzman from BSN 111C, and so for today's video, I'm going to do the assessment of the abdomen return demonstration. So the assessment of the abdomen consists of um, inspection, auscultation, percussion, and palpation. So the abdominal assessment is a part of all comprehensive examination of all ages. So it can provide critical conditions about his or her abdominal organs. First, we have to review the patient's medical record if available. Alright, now we have to determine the scope of this assessment and all the materials needed. So we have to prepare the centimeter ruler, the tape measure, and the ballpoint pen, and of course the stethoscope. Now we're going to perform a hand hygiene or hand washing and of course if deemed necessary, have a dawn gloving. So it is to avoid getting any pathogenic microorganism and to avoid cross-contamination with the patient. So let's get started. Hi ma'am, I am Monica de Guzman, your student nurse for today. And for verification, may I ask what is your name?
My name is Diane Santarin,
And your birthday?
July 9, 19,
How about your age?
26.
Alright, so what do you want me to call you ma'am?
Anything will do.
Alright, so for today, I'm going to assess your abdomen. So I'm going to expose some parts of your abdomen rather. So I'm going to listen to your bowel sound and feel your internal organs. Will that be okay?
Okay.
Alright, do you have any questions regarding to this assessment?
No, ma'am.
Alright, so I'll just close the door and windows to give you privacy so that you'll be more comfortable throughout our assessment. Okay, so make sure before you start the assessment, make sure that the bladder of the patient is empty. So in surveying the abdomen, position the client into a supine position. Alright, so my client is in a supine position already. So we're going to observe abdominal skin. So we're going to look for any vascularities, lesions, scars, and of course a striae or the stretch mark. So we're going to expose the abdomen of the patient. Alright. So now we're going to inspect the umbilicus for its color and contours and of course the location. So we're going to sit beside the client. So we're going to inspect the abdominal girth. So we're going to look for a abdominal enlargement. Next, we're going to measure the abdominal girth using the measuring tape, and at the same time ideally in the morning. So, ma'am, can you stand up? Now we're going to check the symmetry. So we're going to ask the patient to raise her head for the further assess of the diastasis. So, ma'am, can you raise your head? Alright, so you can put it down. And now for the auscultation of the vowel sounds, so we're going to use the diaphragm of the stethoscope and make sure that before putting it in the abdomen, make sure that it is warm. So we're going to perform the auscultation with the right lower quadrant and listen to it for 5 minutes. And now we're going to auscultate the vascular sound, so we're going to use the bell of the stethoscope. Now we're going to auscultate the friction rub over the liver and the spleen. So we place the diaphragm of the stethoscope with the right and left rib cage. Lightly and systematically percuss all quadrants. Now we're going to percuss the right lower quadrant, and of course we have to mark its dullness. Alright, I'll just mark it with my ballpoint. And after that, we're going to percuss the right upper quadrant, and of course marks its dullness. Here, I'll just mark it. And then we're going to measure it. Now we're going to percuss the descent of the liver. So we're going to ask the patient to take a deep breath. So ma'am, can you take a deep breath? Alright, that's it. Hold it for a minute, ma'am. Alright, that's good. Right, I'll just mark it. So you can exhale already. Then we're going to measure the distance. Alright. Now we're going to percuss the spleen. So we're going to begin in the left mid-clavicular line. So we're going to position the patient into a side-lying position. So can you side-lying position now? And then we're going to percuss it. Okay, can you? Alright, yeah. So we're going to perform the second method. So, ma'am, can you exhale? Can you inhale? Alright, so you hold it in. Alright. Now we're going into a blunt percussions in liver. So we're going to sit beside the client or just stand up. So we're going to put the left hand fist against the anterior rib cage of the client. So ma'am, can you tell me if it is painful? Do you feel pain? Alright, that's great. Now we're going to reposition the patient into a into a sitting position rather. So we're going to ask the patient, ma'am, can you sit down? Alright. Now we're going to blunt percussions of the kidneys. So we're going to ask the patient to sit down. So we're going to place our left hand on the costal vertebral angles. So ma'am, can you tell me if it's painful? Do you feel pain?
No.
Did it painful, ma'am?
No.
Alright. Now we're going to percuss the abdominal distension. So we're going to percuss the flanks from the bed upward toward the umbilicus. So now we're going to perform the fluid wave test. So we're going to ask the patient to place the ulnar side of her hand and the lateral side of the forearm. So can you put your ulnar? Yes, like that. Now we're going to put our hands to the opposite side of the abdominal wall. Alright. Now we're going to perform a palpation. So we're going to ask the client into a supine position, and then we're going to palpate on the non-tender of abdominal quadrant. So we're going to palpate. Alright, now we're going to perform a bimanual palpation. So we're going to use our palmar surface of the fingers to compress quadrant. Alright, now we're going to palpate the masses using the fingertips, and then it should be on the depth of 1 centimeter. Now we're going to palpate the umbilicus with its surroundings, so we're going to note any tenderness or any masses. Alright. Now we're going to palpate the aorta, so we're going to use our thumb or our first fingers to assess for pulsation. Now we're going to palpate the liver, so we're going to stand at the right side of the client and put our left hand and under the back of the level of the 11th and 12th ribs. So we're going to ask the client to inhale, then compress inward. Okay, ma'am, can you inhale? Okay, exhale. Okay. Now we're going to palpate by hooking. So we're going to stand at the right side of the client's chest, and then we're going to curl the fingers to the both hands and ask the client to take a deep breath. So ma'am, can you take a deep breath? Alright. Exhale. Now we're going to do a test for cholecystitis. So we're going to press fingers under the liver border of the client of the right costal margin and ask the patient to inhale deeply. So we're going to note for the right upper quadrant and pain and tenderness. Can you inhale deeply, ma'am? Do you feel pain?
No.
Alright, so exhale. Now we're going to palpate the spleen. So we're going to use the two-way method. So we're going to stand at the right side of the client. So we're going to reach for the abdomen with the left arm. So we're going to also to place the right arm below the left costal margin. And then we're going to ask the client to inhale deeply. Okay, so can you deeply rather exhale, and that's great. So can you put into a side lying position? So can you inhale deeply, ma'am? All right. Palpate the kidneys. So we're going to place our left hand into a posterior flank. So we're going to place the right hand on the right upper quadrant. So we're just below the costal margin at the mid-clavicular line. So we also gradually release its pressure. So can you inhale deeply? Exhale. Now we're going to palpate the kidneys. So we're going to begin in the palpating of the symphysis of pubis, and of course we're going to move upward and outward stimate. So we're going to note the for the consistency and tenderness. Now we're going to perform a sensitivity test. So we're going to look at the patient's face to see if there's any pain. Now we're going to perform a SOA sign. So we're going to ask the patient to put into a side lying position. Then we're going to hyperextend his left leg. All right. Can you? All right. Do you feel pain?
No.
Can I go back? Now we're going to test for the obturator sign. So we're going to hold and support the client's right knee. and ankle. So we're going to place the hip and knee and rotate the leg. So um, do you feel pain?
No.
Now we're going to test for the appendicitis. So we're going to assess for the rebound tenderness. We're going to palpate for the appendicitis for at least for by 90 degrees, and we're going to ask the patient if what is more painful. Alright, ma'am. What is the most painful, or when I pressed your abdomen, do you feel pain?
No.
Alright. So how about when I release the pressure? Do you feel any pain?
No.
Alright, that's great. Okay, ma'am, we are done with our assessment, so I'm just gonna state our findings. So for the inspection, I don't see any abnormalities. Your abdomen is asymmetrically. So upon auscultation, your bowel sound is good, so it is normal. There is no bruise sound, there is no venous hum, and in percussing and palpating, I noticed that there is no lesions, bulges, or there is no abnormalities. So all in all, your abdomen is healthy and it is good. So do you have any questions regarding to this assessment?
No.
Alright, so for what I can advise you to do is to drink plenty of water. Instead of drinking a hard like liquor, so you should drink plenty of water, and of course don't hold back your pee, right? Okay, so thank you so much, ma'am, for your cooperation for today's assessment.
Thank you, Nurse.